All right, welcome back to I guess we're going to call this the Dr. Beau Show. These aren't really podcast episodes. These are just on YouTube because I'm trying to explain some concepts, taking a little bit of a break from the podcast. So these won't go in the episode lineup, but let's get into it. So today I'm going to pull something out of my lecture series called Rethinking Running Rehab, or RX3. And this is what I'm going to talk about today is just a common theme that you'll see across the board with a lot of runners that I think leads to a lot of the most common injuries. And the most common injuries tend to be relatively the same. So if we start at the foot, you're going to see things. And again, the names that I'm saying here aren't usually what's actually going on. So it's poor descriptors of tissue pathology, but it's common names that people are going to use, like plantar fasciitis, metatarsal stress fractures, ankle sprains, shin splints, runner's knee, patellar tendinopathy, IT band syndrome, and let's just say generalized hip and low back pain with running, literally any pain in your lower extremity. I think this is so prevalent because of the time and society that we live, along with the tools that we use to run, and all those things pair up to conglomerate with this thing that I call anti-impact reduction syndrome that you're seeing on the screen over here. And the first thing that we're looking at is a pair of feet, and then somebody in some crazy Hokas, which just honestly look like they belong on an alien, or an ostrich decided to design its own shoe. But what you're seeing in this picture on the left is this is rear foot valgus. So no, this is, for the layperson, this is pronation, but this is pronation through the ankle, or the subtalar joint in particular. You can see it's more pronounced left versus right. This is a child. Why this happens is varied, right? This isn't midfoot pronation that you would classically think about, but we're just saying a sloppy foot, a lazy foot, a weak foot, whatever you want to call it. And that can happen for a variety of reasons. Let's just say this foot type that can't control itself that well against the gravitational forces that are being put upon it, just standing, let alone when we add the outside impact forces of running, which is estimated of anywhere from 3 to upwards of 8 times body weight coming up from the ground through your foot up to wherever it's going to end up as your highest impact zone, which is largely due to how you manage load, which is one of the biggest predictors of injury in runners, is the ability to reduce impact. The other picture is obviously these crazy looking shoes, but that's been, shoes have always played a role in running as it seems to pertain to injury, when it may not be that big of a deal. I've brought this up numerous times that if we look at the research, data would say that the most important factor when it comes to shoes, as far as it pertains to running, is comfort. That's going to have the best outcome measures for injury prevention and increased performance. But we've seen everything since I've started running, which was around 2006, from the swing of, the normal stability neutral shoe. Then we got into the barefoot running thing, Vibrams and all of that. And then went to this kind of maximalist focus as trail running in particular became more popular. And we see the need demands on the foot changed. And now we're going back, maybe in my field, to this like minimalist, but hey, we understand a little bit more that maybe, again, the data points to that runners are going to do better with injury prevention in a shoe with a normal heel rise, which would be around 8 millimeters with normal amounts of cushion, but they're better to wear minimalist footwear outside of running, around the house, to work, things like that. So you keep your foot moving, keep your ankle moving. And then the debate would be, in the gym, what do we do? I would say, minimalist footwear, barefoot. But this is what you're going to see, is that we start at the ground, obviously foot meeting ground is where it starts with running. But this is a big deal. And then the next part of this little syndrome in general, and again, if you look at this picture on the left, you're seeing a lot of things occur. And a snapshot is a snapshot. It doesn't dictate function whatsoever, nor does video, nor does movement dictate function. Function on its own, what function means that something's functional. And if my goal is to ambulate from here to there, and I can do that without pain, and I can do that repeatably, that's function. Because there are a lot of, I always bring up Rita Jeptu or Priska Jeptu, that is a marathon runner, has a exponentially or a very aggressive valgus load with a lower extremity abduction moment with a lot of heel whip. And she's won Boston Marathon a couple times. And so you see a lot of different things out there. But the other thing I would say is that you see a reduction an internal rotation at the hip. Now, that may be chicken or egg, that your body starts to limit rotation around the hip so you don't create as much torque, right, via the spinal engine theory, which is another video that I put up, around that hip, which also limits hip extension, which limits peak hip torque, or the amount you can push off. So it may be a sparing strategy for your body when it realizes like you don't have enough stability in the bank to hold yourself together. So I'm going to start laying down pseudo stability patterns, what we call a high threshold pattern, which we're going to talk about in the next slide more. Or it truly could be that the chicken is present here and we don't have internal rotation, which then allows us to not do all those things I said, right? Create normal hip extension moments, peak torque, reduce impact through the femoroacetabular joint. So there's a lot of things that could be at play here. But again, looking at this as a generalized syndrome of, we see a foot that can't take the impact forces. We see a hip that is fairly stiff in internal rotation, which leads to stiffness and extension most of the time, which means we have to then deviate the knee around this foot and hip, right? And what do you see? Usually this bit of valgosity, which means a knee coming in. And then on top of that, and literally on top of that, big chicken or egg here, is this the thing that's, is it a top-down approach or bottom-up? In my clinic, we would typically think like bottom down, but maybe central down, that we're looking at. You see this runner on the right is in a lot of lumbar extension, anterior pelvic tilt, and maybe that's being led that direction because we lack the ability to create or maintain intra-abdominal pressure while we're running, which leads to, you can see the diaphragm and the pelvic floor opposing one another in what would be called an open scissors position. The other thing that we need to talk about here is, what does the human diaphragm do when we're running? Well, obviously it helps us breathe, right? So as you inhale, your diaphragm is going on an eccentric load. So it's stretching as it depresses, which allows you to pull air. We're negative pressure breathers. So we have to pull air into our lungs. And then as you exhale, it relaxes. Well, if you do a forced exhale, that's a concentric contraction, which is happening anyways. It's just that we don't have to actively work for it. It's kind of a rebound effect because negative pressure breathers, right? Air escapes. Humans are the only mammal that have evolved to have the thoracic diaphragm create a dual function. And that is one of stability and drawing in oxygen or breathing. So what do we think happens when we challenge our aerobic ability, or in muscular endurance, or we have low aerobic function? Well, you're going to see what we would call locomotor respiratory coupling, or where we see bigger movements around the body, bigger biomechanical moments to try to help us breathe. And there's a whole panacea around this of, having an improved aerobic capacity is going to improve muscular endurance and vice versa. But in general, this is a very common pattern of seeing somebody in what Dr. Richard Olm would call an extension compression compensation position. Now, that being said, if we get somebody who is a high level mid-distance runner, sprinter, you're going to see this lumbar extension, anterior hip or anterior kind of translation of the hip to do what? To maximize hip peak torque at push off or through hip extension, because that's the most advantageous way to do it. The goal with that person or that runner or that athlete then is, can they exit that position when they're not running? Can they get out of that extension compression compensation? If they can't, that's probably a problem. Problems may arise while we're running, but if we're also thinking short mid distance and not a lot of reps, and we can get out of it and we're doing adequate recovery and cross training and mobility, whatever we're going to call that, you may not have as big a problem, because that may be necessary. Just like putting the angular velocity around your arm to throw a baseball 100 miles per hour is not the best thing for your elbow, even with the best mechanics in the world. And we talked a little bit about these high threshold strategies. High threshold strategy, just imagine if I said, hey, hold your elbow in the most stable position you can. The best strategy for that would be to flex your bicep and lock it down. That's not a good long-term strategy. I will not disagree that your elbow isn't stable, but that's not a great strategy if we had to do that all day long. Because at the end of the day, I can come along, push on your forearm. I'm probably going to win, because that dynamic mover is not meant to posturally stabilize you, especially under aerobic duress. So when we see things like this, bodybuilder is concentrically contracting his glute, right? You can see that. I don't even realize a glute looks like a butterfly until now. But when we see this, you may see a runner or an athlete have a hollow around the gluteal complex on the lateral side. And what we know is they're stuck in a concentric load because that's how they're stabilizing, just like flexing your bicep. So can you now imagine the strategy around running is a foot that doesn't control itself well in space? Maybe we don't have the most mobile hip through internal rotation extension. And then our grand way of creating the best stability on top of all that is to just like keep your hip really stiff, and you hit the ground with 3 to 8 times body weight, however fast you're running in mechanics, albeit there could be a lot of force going through your body, into your spine, into bony cortexes, into tendons that then lead to injuries. And that's what this is about. Again, I hate to paint with broad strokes, but sometimes you need to say, what's the easiest way to look at how a human's moving overall? And, this is really, I came about with this because a lot of the people that are in my courses are students, and I want them to have a broad look at like what may be going on versus like picking on things that don't matter, not understanding how these things play in. And, after having said all this about this anti-impact reduction syndrome, what I would say is we also need to be very aware that we don't want to write a movement narrative that's not true. And what do I mean by that? That when we watch somebody run or walk or squat or lunge, that we're not writing a movement narrative all the way through the kinetic chain that makes sense to us that may not be true whatsoever. So just because your big toe doesn't extend, when I go into a lunge with my trail foot behind me, that I say that creates a knee valgus moment, and then that loads my hip internally. And no wonder I have an anterior hip pinch on that, trail leg when I'm lunging. Maybe your hip's just sensitive for a totally different reason. You're writing this big movement, narrative, which is something that people latch onto, and then that may be damaging because, what if that's something they can't change? What if that's something that doesn't matter, that now they're focused on, that draws them further away from getting out of pain or improving performance? So always be aware that we're trying not to confirm our own biases. I only do this for the benefit of somebody that may be having a hard time understanding why they're experiencing things, or somebody that's dealing with a lot of people that are experiencing these things. So I hope that helped everybody, if I could get my words straight. And, this is a funny little meme. What do you guys say? I know some people say it's meme, and I swear it's meme, whatever. But if this is you, or you're like, man, I know I have a sloppy foot, right? And don't say overpronate. Pronate's normal, right? The speed of pronation, or the angular velocity around pronation, is what matters. The ability to get in and out. We've heard that it's like a breaking and entering. You need to get in and out of pronation. If you ground contact time is another big predictor of injury, that you spend too much time on the ground. So the longer I spend on the ground, the more opportunity there is for me to do what? Not be able to reduce impact. And I'm using contact time to do that for me, rather than upping my cadence, getting poppy, being able to have good energy return through those tissues that are meant to do that, and not overloading the ones that aren't. I hope that, hope that helps somebody. If you have questions, leave them in the comments below. As always, I really appreciate you watching. If you haven't already, check me out on Instagram, Dr. Beau Beard. Hit the subscribe button, check out another video. And again, I'll see you next time.